Hi friends, welcome back to my channel where we use science to myth bust common fitness beliefs and empower you to make informed choices about your health. Today, a topic often surrounded by fear and misinformation, resistance training during pregnancy. You've probably heard, don't lift weights while pregnant, it's not safe for the baby, but this 2024 paper shows a very different story. So the paper, titled Benefits of Resistance Training During Pregnancy for Maternal and Fetal Health, reviewed the current evidence around strength training in pregnant individuals. The authors looked at data on maternal outcomes like strength, glucose control, gestational weight gain, and mental health, as well as fetal outcomes such as growth, birth weight, and delivery health. And their conclusion, when properly prescribed, resistance training is not only safe, it can actually improve health outcomes. It can actually improve health outcomes for both the mother and the baby. So let's start with the pregnant person's side of things. The review found that resistance training can improve muscular strength and endurance, which helps prepare the body for labor and the demands of caring for a newborn, reduce the risk of gestational diabetes by improving insulin sensitivity and glucose regulation, reduce back and pelvic pain by strengthening the postural and stabilizing muscles, and even improve mood and mental well-being, reducing the risk of prenatal depression. These findings line up with previous research, like a 2018 paper, which informed the Canadian guidelines for physical activity during pregnancy, emphasizing that moderate intensity resistance training can safely be part of a prenatal exercise routine. Okay, what about what everybody worries about? Babies' safety. This paper reviewed several studies that tracked fetal growth, heart rate, and delivery outcomes. They found no evidence that resistance training increases the risk of preterm birth, low birth weight, or fetal distress. In fact, babies born to mothers who engaged in resistance training showed healthy birth weights and normal AP-GAR scores, which are used to assess newborn health right after delivery. There's even emerging evidence that maternal exercise might promote healthier placental development, improving nutrient delivery to the baby. So what does safe resistance training during pregnancy look like? This is general evidence-based recommendations. Of course, this is going to differ for the individual. Stick to moderate intensity. Think about a 6 to 7 out of 10 effort level. Avoid exercises that compromise balance because you don't want to fall, or that involve lying flat on your back for a long period of time after the first trimester because the weight of your uterus can restrict blood flow to the baby. Focus on controlled movements and lovely breathing patterns, and always consult a qualified healthcare provider if you're unsure, and especially if you have any pregnancy complications. The key takeaway though from this paper is that the benefits far outweigh the risks, especially when training is appropriate for the individual. For decades, pregnant folk have been told to avoid anything even remotely strenuous, but the research keeps showing that movement, including lifting weights, is not dangerous. What is dangerous is the outdated belief that pregnant bodies are fragile. They're adaptable, capable, and resilient. And resistance training is a fantastic way to support that strength. So the next time someone says, you shouldn't lift that, you're pregnant, you'll know the evidence does say otherwise. Remember, it is your body, your choice. I'm just here to help you make informed ones.